New at 5 o'clock, Indiana's fight against the spread of COVID-19 barely makes a change on this week's metric map. The state health department is reporting 45 counties in red. And remember, that's the highest spread. That's down from one county last week. 46 here are in orange, and still only one county is in yellow. And we have none in the lowest level, which is blue. Hospitalizations keep surging in the state. 3,058 people are hospitalized with the virus. That's the most that we've seen since December 22nd of last year. Now, nearly 1/3 of that number is in the ICU. IU Health says they're caring for 496 COVID patients at its hospitals all across the state. Last week, IU Health asked for help from the Indiana National Guard. Now, when it comes to Guard support, teams are now stationed at 13 of IU's 16 hospitals statewide.
A crackdown on COVID vaccine requirements looms as state lawmakers return to work. State lawmakers tomorrow will begin debating restrictions on when employers can require the shot. Garrett Bergquist is the newest addition to the Wish TV team. He's here now to tell us what we can expect. Garrett.
Well, state lawmakers officially don't even return to session until January 4th, but Republican House leaders plan to take testimony on the measure tomorrow morning. The bill would prohibit any employer from requiring a COVID-19 vaccine unless employees could opt out for medical or religious reasons. Employers would have to cover the costs of any mandatory COVID-19 testing and couldn't test employees more than once a week. A push to pass the bill in one day fell apart last month after strong objections from business and medical groups. Indiana Chamber of Commerce President Kevin Brinegar says his businesses don't want any mandates for or against vaccines.
In some respects, this legislation would not affect that many employers, but for those that have, particularly in the healthcare field, this could be a real disruption.
House Majority Leader Matt Lehman wrote the bill. We contacted his office, but they were not able to make him available before our deadline. The hearing begins at 9 a.m. tomorrow in the House chamber. The committee chair does not expect to take a vote. On last Sunday's episode of All Indiana Politics, Governor Eric Holcomb would not tell us how he would act on such legislation, but he told us he generally favors letting individual businesses make that call. And coming up at 6, I'll tell you how much this could end up costing some businesses. Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.
All right, welcome to the team. Garrett, thank you very much. The CDC's vaccine advisors will meet tomorrow to discuss benefits and risks of the Johnson & Johnson vaccine. They're expected to hear presentations on a rare type of blood clotting condition that has been linked to the vaccine. The advisors could vote to update recommendations for use. Right now, it's authorized for people 18 and older, and those who got it are advised to get a booster of any of the vaccines.